Hello everyone. Today we are going to discuss about the most interesting topic, hippotherapy. Hippo is a Greek word called horse. Hippotherapy is the treatment with the help of horse, that is equine assisted treatment. The horse pelvis has a similar three-dimensional movement to the human's pelvis during walk. This is how hippotherapy is. So, who are included in the hippotherapy team? A physiotherapist, horse trainer, and riding instructors walking on both sides of the horse. Physiotherapist controls the horse gait velocity, and orients the horse into various directions, and all these movements include neuromuscular and sensory reactions in the patient. History. Firstly, it was mentioned in the work of Hippocrates during 460 BC, but it was not an established protocol till 1960s. During 1960s, Germany, Sweden, Austria introduced into their medicine. American Hippotherapy Association then found this in 1992 and certified in 1999. Later in India also as well. What are the indications of hippotherapy? Hippotherapy is an effective way to increase physical and emotional health of children with cerebral palsy. It has potential to develop the child physical strength and endurance, and also to increase balance, and also improves child's communication skills as they interact with horse therapist, and improves self-confidence. Hippotherapy helps to strengthen the weakened muscles of child with cerebral palsy, improves balance and flexibility, improves fine motor control skills in everyday tasks. Next one, traumatic brain injury. In traumatic brain injury, there will be concentration or memory problems, fatigue, loss of balance, sensory problems, and loss of coordination. So, hippotherapy helps to recover all these problems. Down syndrome. What is Down syndrome? Genetic condition in which the child is born with an extra chromosome. What are the characteristics of Down syndrome? Low muscle tone, weakness in the trunk and limbs, impulsive behavior, short attention span, slow learning, impaired social skills. In this case, hippotherapy is the effective treatment because it provides sensory stimulation to the muscles and joints and improves balance, body awareness, postural control. It can also help with cognitive, behavioral, and communication skills. Autism spectrum disorder. This is the developmental disorder of brain. There are difficulties in verbal and non-verbal communication, sensory processing, understanding or reading social cues. Hippotherapy improves one's balance, strength, motor coordination, promotes language, sensory regulation. And some other benefits are also in autistic population are: it relaxes tight muscles, builds muscle strength, improves coordination, sharpening eye to hand coordination, gaining self control, activeness, self confidence, and concentration. It also increases socialization. Next, muscular dystrophy. Muscular dystrophy is a group of diseases that causes progressive weakness and loss of muscle mass. It also helps in improving flexibility and free from pain, and also strengthen muscles. In amputated patients also it is very helpful. Cerebrovascular diseases, multiple sclerosis. What is multiple sclerosis? The immune system that attacks the myelin sheath that covers the nerve fibers that cause neural communication problems between the brain and body. In this, numbness and weakness of one or more limbs and lack of coordination will be present. Psychiatric diseases. It also improves psychological problems and makes more stronger. In spinal cord injuries, patient experiences stiffness or weakness of the muscles, respiratory problems, and cardiovascular problems. Next one is rheumatismal joint diseases. It experiences joint pain, stiffness and reduced range of motion, and hippotherapy helps in increases physical activity, strength and flexibility. There are three approaches in hippotherapy: neuromotor approach, sensory motor approach, psychomotor or sociomotor approach. During hippotherapy, more than 100 three-dimensional vibrational pulses per minute are transferred to the patient when the horse is led at walking pace with patient sitting upright on the horse. This is called as neuromotor approach. Sensory motor approach. Children and adults sense the body of the horse receives sensory stimulus. Psychomotor or sociomotor approach. The horse has psychomental effect on the patient. That is psychomotor approach. Hippotherapy as physiotherapy. In physical therapy, multi-directional movements of the horse are utilized in gait training, balance, postural control, strengthening, increases range of motion, and in many studies, improvements in gross motor skills and functional activities are also reported. Why horses are used? During ambulation, the horses provides a rhythmic movement that stimulates anterior and posterior swinging movements. And the movements of the horse encourage the rider to achieve a proper balance and posture. The horse and those around provide the rider a large spectrum of sensory and motor input. When to start this therapy? When the patient has ability to stay upright and hold head up with the weight of helmet during the session. And the patient should have endurance to remain saddled throughout the treatment period. When the therapist thinks that patient needs specialized equipment to treat. What are the ways of horse handling? Walking speed. Based on the stride length and cadence, it improves amplitude of the movement of patient. Walking surface. Two surfaces, hard surface and soft surface. Hard surface increases movement impulses and walk rhythm, and soft surface increases intensity of therapy. Horses move differently on downhill and uphill also. Walking direction. Horses move differently in straight lines than in changing directions. Position on horse. Assisted kneeling and sitting position. Mechanism. This is a three-axial movement pattern. It mimics the normal movement of pelvis during walking. It provides sensory feedback. And there are core connection, sensory connection, communication connection, and neural connection. What are the benefits? Respiratory control. It improves postural symmetry, decreases abnormal muscle tone, control of the extremities, trunk core strength, improves gross motor skills, enhances balance and strength, increased endurance, reduces spasticity, shortens the recovery time, works twice as normal gait training. Children enjoys the therapy and it improves communication skills. It able to receive visual cues. Why hippotherapy produces good results? Why hippotherapy is beneficial? Because horses move rhythmically at various foreseeable places to which body movements easily adapt. Horses are extremely receptive to body language and gestures and capable of eliciting intense sentiments and emotions. This hippotherapy provides visuospatial stimuli by environment in association with horse movements. Because horses possess range of qualities like warmth, softness, smell, regular movements, larger eyes with penetrating gaze. And the contact with large animal aids perception and self-awareness. What are the contraindications of hippotherapy? Orthopedic contraindications are atlantoaxial instability, coxa arthrosis, myositis ossificans, joint dislocation, spinal fusion, osteoporosis, spinal deformities. Neurological contraindications are hydrocephalus, seizures, spina bifida. And the medical contraindications are allergies, blood pressure, high blood pressure or low blood pressure, respiratory problems, cardiac abnormalities, peripheral vascular diseases, recent surgeries or any indwelling catheters. So, the patient with these complications should not eligible to hippotherapy. Thank you. Hope you enjoyed this video. Like, comment, share and subscribe for more updates.